Hello, this is Evan Brand, certified functional medicine practitioner and nutritional therapist, operating worldwide via phone and Skype consults from evanbrand.com. Now, on to today's guest. Dr. Justin Marchegiani is a graduate of the University of Massachusetts with a degree in kinesiology and pre-medical studies. Dr. Justin has completed his doctorate degree in chiropractic from Life West University and is a licensed doctor of chiropractic in the state of Texas. He's completed postgraduate study in the area of clinical nutrition, rehab exercise, and functional medicine so he can offer the most cutting-edge techniques to help address his patients' growing healthcare needs. Dr. J works with that's what I call him, Dr. J. He works with a wide variety of patients, all the way from athletes trying to increase performance and heal injuries to the everyday person with chronic health challenges. Using a holistic approach, he addresses core underlying barriers to health, which allows his patients to heal faster and feel better. Dr. J and I have done so much stuff together in terms of podcasting. We speak every single week, and he's really just increased my clinical education and experience and knowledge and has significantly played a huge role in my life as a clinician. So first of all, just want to say thank you so much to him for that. And let's get right into this interview. Dr. Justin Marchegiani, welcome.
Hey, Evan, it's a pleasure to be here, man. How are you doing today?
Oh, I'm doing great. The sun is shining. I can't complain. I always love getting together and creating content. So I'm super happy to have you as part of this. I think with your experience, your knowledge, the body systems that you work on with people, this conversation is going to be critical. You know, we've hit on heavy metals and Candida, and we've hit on all these other little nuanced topics, but I feel like we've used a microscope. And part of this conversation of getting clients better is not just a little minutia that sounds good and sells books, but it's completing all these body systems together. So that's why I have you on here, because some people, like I said, they zoom in, but they zoom in so much that they miss the big picture and then they don't get the clinical outcome they're looking for.
100%. And we're used to chatting on my podcast and your podcast. So it's great doing a summit together because I imagine, we have a phenomenal chemistry compared to most people that you're not chatting with on a weekly basis. So I'm hoping to bring this together for a phenomenal summit interview.
Agreed. Yeah, just so for people to know, if you just start Googling Dr. Justin Marchegiani, Evan Brand, you're going to find that we do hundreds and hundreds and hundreds of hours of content together. So make sure that you go subscribe to our podcast and you stalk us if you're not already, because we do this clinical Pearl 101 stuff every single week. But let's dive in with Candida. Can you just give us some statistics about what are you seeing in the clinic? You've worked with over 2,000 patients and counting now. What are you seeing statistically in terms of yeast and then some of these other infections?
So I definitely see Candida as a major issue. It's either going to be Candida by itself, where we tend to see a lot of Candida by itself, especially with people early on with lots of antibiotic use, because this antibiotic use creates a rebound overgrowth. It's kind of like going out to your garden and just doing a whole bunch of weeding. You don't ever have to grow weeds. Weeds grow automatically. So as soon as you clear that soil and you pull the weeds up, well, unless you put down good seeds, weeds are going to grow automatically. So we have this rebound overgrowth effect with antibiotic use that can drive a lot of Candida, which is a type of fungus, right? So imagine fungus as this big umbrella. Under fungus, you have yeast, and Candida is a type of yeast. And then you also have molds as well, which is kind of in that fungus group, which is like, a lot of the black mold that you hear about with people having mycotoxin issues. So yes, we have the antibiotic overgrowth issue. We have fungus and other people that have other types of infections where it may not be a primary fungal issue. It may be an H. pylori or another type of parasitic infection, and the fungus can be part of it, or it can be a secondary issue where we have to clean out some of the more primary infections.
Yeah, let's dive into the H. pylori piece. I think that's important to hit on, and nobody has spoke on this yet. Give us like maybe the domino effect or the cascade of events that happens where someone can pick up an H. pylori infection and then stomach acid levels are dropping and yeast is becoming opportunistic. Can you talk us through what is happening and how this all takes place?
Absolutely. So imagine this metaphorical stress bucket, right? Big bucket. We put various stressors in this bucket. These stressors could be physical, like excess physical exercise, too much CrossFit, not enough movement. It could be poor diet, gluten sensitivity, leaky gut. It could be other types of infections. It could be just poor sleep. It could be on the emotional stress side. It could be work stress, family stress, relationship stress. And then we have the chemical stressors, which I mentioned are the heavy metals, could be the microbes, the infections, the poor diet, the poor nutrient levels, the inflammatory diet, the gluten sensitivity, the infections. All of these stressors go into our stress bucket. And most people, when they talk about stress or think about stress, they only connect stress to the emotional side. People don't think, hey, if I'm sitting on an island chilling out and I'm having some gluten, that may be creating an internal stressor, even though emotionally you're totally chilled out and relaxed. So these stressors fill up that bucket. When that bucket gets full, that puts stress on our body systems, our hormonal system, adrenal, thyroid, female or male hormones, our digestive system, and our immune system, which they're intertwined. If you have digestive distress, you're going to typically have a weaker immune system. When your immune system is weaker, that decreases your IgA levels, which is that protective immune mucosal barrier, which is that first line of defense for the immune system. And that basically lowers the drawbridge. It lowers the force field. If you're a Star Trek fan, right now the Klingons can come in and attack. And that's what's happening. We're weakening that shield, and then we get exposed to these infections via bad water, bad food, via people, whether it's intimacy from an infection, or it could even be just via saliva and non-intimate connection, right? Let's say you're sharing, a glass of water with someone, right? Or, you give your kid an innocent type of kiss, right? That could easily spread these type of saliva back and forth. And then last is pets. So it's going to be people, pets, water, and food. And again, the more compromised your immune system is, the less bolus or the smaller, even a smaller amount of the infection debris could be enough to set up shop, where you could have a really strong, robust immune system. But if you get exposed to a large amount of debris, like you're going and you're drinking water when you're hiking and you just a lot of Giardia in there, that may be enough to overwhelm even someone with a healthy IgA level. And that may be enough to set up an infection.
Yep, well said. And I had H. pylori, I had Giardia, I had crypto, and thanks to you, you looked at me and you said, I came over to your house and you're like, dude, you've got parasites. And I'm like, how do you know? And you're like, well, look at you. You've lost muscle. I saw old pictures of you. You used to have more muscle. You're getting starved. Something's stealing your nutrients.
We were looking at your diet too. You were eating adequate amounts of food. So the fact that you were losing that much weight, it didn't quite make sense from an absorption standpoint.
Yeah. So you said, hey, go get a stool test. That's what I did. And I showed up with not just parasites, but the H. pylori infection too. Get us up to speed on H. pylori. We know it's a bacterial infection. Can you just talk about how often are you seeing this? How common is it? And then what's it doing to promote Candida?
Great question. So off the bat, when we look at H. pylori, that falls into the category of a gram-negative bacteria. So we have gram-negative and gram-positive. Okay, gram-negative are going to be like Citrobacter and Proteus and Klebsiella and Morganella, right? These bacteria, they have two cell walls. So imagine gram-negative bacteria. Imagine you have a castle, okay? You have the first wall, the first line of defense is the moat, okay? You have the drawbridge to get over the moat. And then the second line of defense is the castle wall. So imagine trying to scale a castle when there's no moat. Well, it's easier. You just go right up to the wall, you scale it. Gram-negative bacteria, they're harder to kill because they got these two cell walls. And imagine the outer cell wall, imagine that being the moat. Imagine in that moat, there's like some kind of toxic acid, right? Well, that's what the H. pylori has. That outer cell wall, that gram-negative bacteria has something called LPS, or lipopolysaccharide, which is another form of endotoxin. So it's actually toxic to your body and to your liver. So number one, it's got a second wall that you have to penetrate and break down to kill it. But number two, that wall is actually toxic and puts stress on your body, so that when you do kill it, your liver undergoes some significant stress. So we have to add in different supports to help. Now, again, these critters could be primary infections, where they are the infection that's causing the issue, right? And a lot of times they're also going to have other types of infectious debris with it. Why? Because when your immune system's compromised, other infections can also gain a foothold. And it's really easy for things like Candida to slip in, especially if there's excess refined carbohydrate or previous antibiotic use. That can drive a lot of that rebound overgrowth, increase the Candida. If the refined carbohydrate are there as well, that can also increase it too. And, birds of a feather flock together as well.
So let's chat about the order of operations. I mean, you've got so many practitioners that say, look, this is the only way. It's this solution or that solution, and more bone broth and glutamine and all these other gut healing nutrients. But, something that you've taught me well, which I'm grateful for, for being your wingman and, like I said, doing content together and sharing clinical stories. You said, look, you've got to do things in a certain order. Otherwise, you're going to have these rebound effects and your protocol is not going to work. You've spent this money on functional medicine testing. You've spent this money on supplement protocols, and then people show up at your door and they're like, hey, look, it didn't work. Talk us through why that happens.
So with a lot of these critters, like I mentioned the Candida, or I mentioned the H. pylori and the lipopolysaccharide, that outer cell wall. So visualize it as the moat, right? And I use a lot of analogies and pictures when I teach and educate, because it'll be impossible for you to forget gram-negative bacteria and to visualize the castle with the moat and the acid in it, right? It's going to be impossible for you to forget that. So you can understand that concept. But when we kill these chemicals, when we kill these infections, that's stressful on the body. So if you don't have your diet dialed in yet, if your digestion stinks, if you don't have the ability to regulate inflammation and generate energy, we're adding more toxins to the system. And we're expecting our patients to start to feel better. Well, they may, but in the short run, they're probably going to feel worse. And as a practitioner, we need patients to be compliant. So we have to really get the adrenals and the hormones dialed in first to regulate energy, regulate inflammation, have decent Krebs cycle or mitochondrial activation, so we have good nutrients to run those cellular systems, make sure we're digesting and breaking down our food. And then when we start the killing, we typically like to hit H. pylori first, parasite second, yeast third, in that order. And we may even add some binders in there. And we may do it in a way where we gently taper that dose up, not to overwhelm our patients with all of that excess dead debris that's coming off.
Well said. So what happens if someone's too weak? Let's say there's adrenal, there's thyroid problems, there's mitochondrial issues, which you alluded to, and you try to come in, you've got this heavy hitting herbal protocol. What can happen if these other body systems aren't supported?
Well, the big thing is you're going to have fatigue. You're going to have brain fog. You may even have constipation or diarrhea, because the chemicals that are being released may disrupt peristalsis and that migrating motor complex. So you may not be able to move fecal material out of the body as fast, or the toxic overload really freaks the body out and it pulls a whole bunch of water into the intestines to flush it out. So any of these digestive issues, obviously mood issues, energy issues, inflammation in the gut's going to create inflammation in the brain. Inflammation in the brain can manifest as depression, anxiety, and or brain fog and cognitive issues. So, of course, all of these are potential side effects. Some people could even be achy joints, too, because these chemicals with a leaky gut can make their way into the bloodstream and can kind of settle in some of the joints and create inflammation in that way.
How do you feel about the people that say you have to get worse before you get better? Like these people who talk about a Herxheimer reaction, this kind of die-off detox reaction as a good thing.
I mean, I think sometimes it may happen inevitably, but I think we can decrease the chance of it happening, though. Most people, they tend to do it to themselves. Even my patients that are super smart, they're on track, because once someone finds out they have an infection, they just freak out and want to kill it. And there's this mindset of like, I don't care, I'm going to just grit it and bear it. And I'm like, no, there's a sequence. Let's taper it up. Let's add in the ginger tea. Let's add in some pectin, some fiber, some activated charcoal. Let's do it. So let's taper it. And some people, they just got a one-track mind and they just go and they just say, I'm going to kill it. So we recommend getting the adrenals and the digestion and the hormones dialed in, tapering up the herbs slower. That gives you the best chance of having the smallest amount of die-off, the smallest amount of issues. Every now and then I get a patient where even just one capsule of something with food is still too much, right? So there's going to, every now and then there'll be someone where it's so difficult, but we have to go slower and we have to really work on the first body system and really work on the binders and really work on the lymphatic system and the detoxification system so we can flush things out in a gentle manner.
Yep. Well said. And just for folks listening, I mean, this is the three, maybe you call it 3.5, 4 body system approach that I use in my clinic as well. And, like Justin and I work on this stuff every week. And this is the order of operation that gets people better with the least amount of side effects. I've had people, and I'm sure you have too, where they'll come in and they'll be like, okay, I went to this practitioner. The first thing they wanted to do was heavy metal chelation and taking me to the dentist. and getting all of my silver fillings cut out and blah blah blah, and then they're basically like bed bound and they can't get out of bed because they destroyed themselves.
100%. So we don't want to, number one, liberate more toxins, whether it's from chelating or pulling out metals or releasing infectious debris in someone's intestines, and that being the toxic byproduct, like I mentioned, from the LPS and the endotoxin and that gram-negative bacteria. I think those are misguided approaches. I think it makes sense that most people that any practitioner is going to see have an issue with inflammation. And that inflammation is going to mess up the digestive system, the immune system. It's going to affect amino acid absorption. It's going to affect neurotransmitters. It's going to affect energy. So if we can work on those systems first and build up a better foundation, we can come in there, get them feeling better. And as a practitioner, you only got so many shots with patients. I mean, I always let patients know, this is going to be our plan A. But if we have to go to plan B or plan C or plan D because something isn't working right, we can do that. And if we have to go to plan B, plan C, plan D too fast, and patients aren't having enough confidence in you and seeing a little bit of results, that may prevent us from getting them to that body system 2 phase where we start knocking out these critters. So from a patient compliance standpoint, you only have so much time with the patient, so we have to get them feeling a little bit better, getting their energy up, getting the inflammation down, so we can create rapport and keep the compliance going. Because if they're not compliant, I can't get rid of that infection for them.
Yep, well said. Let's talk about the timeline a bit. Let's say that we've already done some work. Typically what you're going to do, and I know this because this is what I'm doing as well, you're going to look at the adrenal glands, you're going to look at the thyroid, check for autoimmune disease, things like that, if we're dealing with Hashimoto's or potential Hashimoto's. Let's say you've got all that dialed in, you've got the gut work looked at, now you're ready to move into the gut work. How long should a gut protocol be, or how long can it be, I guess, to get you through the killing and then the gut healing or restoration phase?
I would say a minimum of 60 days. Again, some people that we see that are chronically ill, they're going to have a combination of a parasite or two. They may have H. pylori. They may have a fungal overgrowth. We may see some weakened IgA levels. We may see some low enzyme levels. We may see some maldigested fat in their stool. So there may be a bunch of things that we see that are happening. Right. So, of course, we have to address each of those one by one, and we do our best to get through a 60-day or maybe a 90-day protocol, and then we retest. And the other vectors are maybe there's a reinfection because of kids or a spouse or an animal in the family that's reinfecting. So we always retest. And sometimes on that retest, we may see a new infection present, which sometimes can happen because infections that are been there longer tend to burrow deeper into the intestinal tract and may not show initially on that stool test. So some people, I'd say 70 to 80%, we can get them completed in one round. That 20 or 30% may need a second, maybe 10% need a third round, depending on how long and how chronic the issues have been there.
Yeah, well said. So let's dive a little deeper into that topic. So what you're saying is it could be like an onion where you may have a surface level infection. Can you say, or is it just random? Like, is it H. pylori is the first thing that can get cleared out and the parasites are the things you're clearing on second round, or is it just kind of all over the place?
Well, I mean, this approach I kind of got from Dr. William Timmons, but basically we work proximal to distal. We work at the superior end of the intestinal tract all the way down to the inferior. So H. pylori tends to reside more in the stomach area to upper small intestine. We have the parasites tend to be more in the small intestine, and then the yeast tends to be at the end part. So we tend to work with H. pylori first, parasites second, yeast third. And of course, a lot of the herbs have a lot of carryover. So am I really expecting myself only to give an herb that only touches H. pylori and nothing else? No. Of course, there's this carryover because some of the herbs like berberines may also have antibacterial qualities, right? But they also may have some antifungal qualities and anti-parasitic qualities. So of course, but there's certain herbal formulas that we have that tend to have more focus on one type of infection than the other. So we work from top to bottom.
Well, great,
H.
great.
pylori,
Okay.
parasites, fungus third.
Good, good. Okay, now let's just briefly
And then
chat about
actually,
the.
even after that, we may go deeper into other types of like maybe Lyme types of co-infections. Again, the issue with Lyme is a lot of Lyme docs out there that are so hyper myopically focused on Lyme, where they may have other types of gut infections that create similar symptoms of Lyme, and people are myopically focused on it, but there could be other gut bugs and other issues like, a lot of the Lyme symptoms, whether it's fatigue or brain fog or joint pain, those kind of things are also similar symptoms to parasites. So just because someone says that you have some IgG positive for Lyme, well, you got to rule out, in my opinion, the hierarchy of infections.
I agree. So you're saying at the bottom of the food chain, that would be the Lyme plus the co-infections, meaning if you take care of H. pylori, maybe you've got like a Pseudomonas infection, you've got Klebsiella, Citrobacter, Prevotella, some of these autoimmune triggering bacteria. If you target those first, you may be able to move the needle a bit more. Then you come in and focus on, say, your Bartonellas, your Mycoplasmas, your Babesiosis, things like that. Is that correct?
Correct. And a lot of the herbs that Stephen Buhner loves for Lyme, some of the berberines and wormwood herbs, we're going to be using them with some of the anti-parasitic protocols.
Yeah.
So a lot of that will kind of make its way downstream. Of course, we may use different things like berber or banderol or cemento or maybe other types of formulas specific to Lyme as well. And you'll see a lot of those formulas have herbs that we've used in the parasitic program too.
Yep, well said. That's just so good to hear because many people they get paralyzed with a Lyme diagnosis and they feel like they have to go to like a Lyme literate medical doctor. But even in those cases, these guys are still very often using conventional antibiotics or even a PICC line with IV antibiotics, and they get destroyed. And then they come to somebody like you and they say, "Look, I've been wrecked. Please help." And then you come in with the herbs, and the success rate tends to be very, very high, and the die off or side effects are very, very low. So I wanted to bring that up and just have you hit on this whole conventional versus functional piece because I think it's important.
Yeah, and not to get too far off the Candida summit here, but a lot of the side effects for chronic antibiotic use are similar side effects of chronic Lyme. So I do believe chronic Lyme exists for sure. We just have to be careful because a lot of these people that are being treated on the antibiotic side, some of those side effects of long-term antibiotic use can be very similar to chronic Lyme. So then it's this self-defeating cycle where, oh no, it's the Lyme. It's like, well, how is it not just maybe the antibiotics that have been used for a while? So that's why I'm a big fan of, if we're doing Candida or any of these types of things, if we're going to have a long-term strategy, we want it to be more botanical based, herbal based. Now in the antifungal world, some of the more safer ones are like nystatin. These are pretty safe. Nystatin's a good one. Amphotericin B in an oral form that tends to be compounded is really good as well because it stays more in the gut. So those are some good formulas, but I would still always combine some of the botanicals with it. So of course, emulsified high dose oil of oregano is going to be phenomenal. Berberines, good colloidal silver or silver solutions going to be, nano silver is going to be phenomenal. Of course, we can add in undecanoic acid. We could do a whole number of things. Of course, like in my GI Clear 4, we have some grapefruit seed extract, and those types of things are also phenomenal. Pau d'Arco is also great too. We have that in my GI Clear 6. Olive leaf is also great too. Some great herbs there.
Love Paul d'Arco. What about doing like a Paul d'Arco tea? Would that just be like an adjunct therapy? Or if you just wanted to start, maybe you just had Candida and no other issues, could you do something real simple and low key like a tea, or is that not going to cut it?
I think you could, but the biggest issue is a lot of the herbs to get to a therapeutic level, they taste pretty darn nasty if you're drinking them. So I said that would be the only kind of downfall. But yeah, it's definitely not going to hurt. Ginger's also great too because there's a lot of these critters, they may have biofilms attached to them as well. And biofilms kind of create this protective kind of shield to prevent these critters from these herbs from hitting the critters. And that could be a big issue too.
Are you using specific, or do you think you need to use specific biofilm busters like your serrapeptidase enzymes and such? Or are you saying that some of these herbs you're talking about do have a biofilm busting property to them?
So if I want to really have some good biofilm busting effects, I'll throw in my GI Clear 3, which has the nano silver. Silver is shown to have amazing biofilm qualities. They are actually wrapping total joints in orthopedic surgery with a silver cellophane because they're finding it has amazing effects against MRSA.
That's incredible.
and biofilms. And of course, part of the lymphatic support that we give, which is the ginger tea, we juice that ginger. Ginger has amazing effects with biofilms as well. So if we can use herbs that have multiple effects, meaning they help the lymphatic system, they keep the interplay between the tissue and the blood and that fluid moving. If we can use herbs like ginger to help, ginger also helps with the migrating motor complex. So it keeps the stools and the peristalsis of moving that fecal debris through the intestines really well, so we don't reabsorb a lot of that toxin, and it helps with the biofilm. So you can see we get like a 3-for-1. We may throw some extra silver in there as well to help even more.
How often are you using the silver? Is that just like a case by case basis? If they're really symptomatic, you go ahead and say, okay, we're going to use silver, or how do you approach that?
I use it a lot with Candida as well. I think silver is great against Candida, especially if someone has any issues with oral thrush or oral Candida. We'll have them gargle with the silver for like a couple of minutes and then swallow it. And that way it can kill any of this Candida that's lodged in the throat or the mouth. And that way it hits the whole entire cavity.
So let's say you have 10 different cases. Let's say some have H. pylori, some have H. pylori plus bacteria, some have H. pylori bacteria and Candida. Are you picking and choosing, okay, the more infections there are, the more I need silver? Or are there some times where you're just hitting these herbs that you mentioned?
Typically, if it's primary Candida issues or more infections, like if we have an H. pylori, we'll throw some H. pylori herbs in there, like a GI Clear 1 or 2. If we see more parasite stuff going on, we'll throw in maybe the GI Clear 4 and 6. And then if we see a lot of Candida, we'll throw in the 5 and the 3.
Okay.
The oregano and the silver. A lot of the parasite stuff will be the high dose berberines and wormwood. And then maybe even the mimosa pudica as well.
Yeah, that's something that you and I've been using, and I've been seeing people pooping out worms. I'm getting more pictures than I would like to see in my inbox of people pooping out anywhere between 1-inch and 10-inch worms. So that mimosa is just amazing. For people that don't know what it is, Justin and I have been using it, and basically it is a South American tree, but it's ground up into, they take the seed, they grind it up, and it acts as almost like a jelly is kind of my interpretation of it. And it basically pulls everything off that's stuck to the intestinal wall. And we're having clients say they feel so much better just by pulling that stuff out. So I think a lot of the herbs we're using to kill stuff is incredible. When you combine that with stuff to pull things out, it's like a 1-2 punch.
Exactly. 100%.
Well, we'll wrap this thing up because I think it's straight to the point and no filler, all killer is what we do
That's
best.
it. Hey, I love that. I'm going to take that one.
So
Great
if
book.
anybody has any questions or they want to reach out to Justin. That is the starting place for my health journey to really take it to the next level. Like I had this nutritional therapy background, and then I was getting into functional medicine, and I was lucky enough to, I don't even remember how Justin and I started our friendship together, but we lived in Austin, Texas together, and I went over to his house, and that was all she wrote. And, now we're creating content every week. So I encourage you, if you do have questions, concerns, you have problems, reach out to Justin. Even if you are not in need of a practitioner currently, go study our content. I mean, Justin has hundreds of whiteboard videos where he's by himself. And then we have, like I said, probably 100 videos where we're doing stuff together. So if you like this kind of rapport that we've got going on, stay tuned, and you're going to see more from us two together than any other speaker on this event. So make sure you stalk us. We appreciate the support. Dr. J, any other last words of wisdom or pieces of advice you want to leave our listeners?
Yeah, I would say to get more content and info, see your podcast, evanbrand.com, mine at justinhealth.com. Lots of free information that basically extends this conversation here. But I said the big thing is, I know you're doing this summit, right? The Candida Summit. And there's a lot of people that do summits out there. And I would say the biggest qualm I have, I think it's great putting this kind of information, but there are a lot of people that aren't practitioners doing this type of stuff. Not a problem. But when you have a practitioner perspective and you're in the trenches dozens of times a week and you work with thousands of patients, there's a different perspective that you bring. Your patients teach you so much because you use things, you apply diet strategies, supplement strategies, you work on compliance, you see the common pitfalls. These things cannot be learned in a book. These things cannot be learned from a study. Right? If you're trying to develop and change what you're doing from a study. It's impossible because they have to isolate one variable in a study. And when we work with patients, we're moving dozens of variables per time. So we get all kinds of feedback. We learn from our patients, and we have the experience that's clinically based, which means getting people better faster. So when you hear interviews with myself or Evan, that is being infused into the interview. The questions that we're asking are going to be clinically relevant. So as the patient listening, or the person that has health issues is listening, they want clinically relevant information. And that's the perspective that we're going to be driving in, and that you'll be driving in for the summit. So I appreciate that, Evan.
1,000,000%. I mean, the problem is, and I'm not going to put these people on blast and call them out, but the problem is a lot of these internet marketer people, and I know many that we could call out by name, that they have the doctor credential or medical doc or chiropractor or whatever, and they've never, ever, ever seen a single client or patient in their life. However,
some of the biggest names out there haven't even seen one functional medicine patient ever.
Not even one. And they've got the biggest name, the biggest amount of followers, and they're the ones creating the content that then Justin and I have to come rectify the issues with their content because it's not clinical. It says, this study says this, so here's what you need to do, but it's not clinical. So there's a lot of confusion out there. We're not saying don't learn, don't educate yourself, but man, I tell you, if you're paying attention to a practitioner creating content, it's going to be 1,000 times more valuable than just a person with a credential creating content.
And again, I don't want to put any of these people down because I know some of them personally and they have phenomenal information, but people listening, if you have the clinical framework, meaning the clinical framework is how does this information, how do you plug it in and apply it within the program? That's what matters, because you get information overload, and it's like, Jeopardy style information where it's great to know if you're on Jeopardy, but how do I plug it in and use it? And that's kind of what we're trying to do here. We're trying to get you to use it. So what are the big things? Cut the refined sugar out, get the digestion on track, figure out if there's deeper infections with Candida and maybe things outside of Candida. Of course, we talked about various botanicals. More resistant people may need to add in an antifungal medication, which tend to be safer than antibiotics, but again, tend to go with botanicals first. Retest, make sure there's no other lingering infections. Avoid the potential vectors from other people in your family or your household that could reinfect you. And then, of course, we talked about the binders, we talked about the die-off, we talked about the order of operations that needs to be done to allow you to have the best success. That's the framework here. Now, hoping all the other interviews, we can plug more of that information into that framework.
Yep, well said. And get your family, your friends, your spouses, whoever you're with, get them tested too. Like you mentioned, the reinfection part. So we could do a whole nother hour, which we don't have today. But thanks so much. You're the best. Always good chatting with you, and we'll let you go.
Thanks so much, Evan. I appreciate it.
Take care.